Hi, I'm Brittany Arender, and today I'm going to be doing my central line dressing change checkoff. The first thing I'm going to do is verify my physician's order, and I'm also going to make sure that I am aware of my facility protocols when it comes to what they require for a central line dressing change. I'm going to gather my supplies, which I've done, and I'm going to identify my patient. I've also done that, and I'm going to perform hand hygiene and put on clean gloves. Now, my patient, if they couldn't turn their head away from the central line site, I would put a surgical mask on them, and then I will also put on a surgical mask. So once I've done that, I am going to then peel away the old dressing. So I'm going to slowly peel towards the central line site. So I'll peel that away, and then I'll remove the bio patch as well. I'm going to discard of that. And then I'm going to remove my old gloves and perform hand hygiene again. Okay, once I've done that, I am going to put on my sterile gloves. So I have my kit here. Open it away. Grab my gloves. I'm going to don my dominant hand first. Okay, and then I'm going to don my other hand. Okay, so then I can get rid of that. All right, so now I'm sterile. So what I'm going to do is assess the skin, assess the site around the central line, assess for any redness, swelling, drainage, anything that could prompt signs and symptoms of an infection. So once I've done that, I'm going to then clean my central line. Our kit comes with these betadine sticks. So I would open these, and I'm going to clean vertically around the insertion site, toss that. I'm gonna get the other stick, and I'm going to clean horizontally, and then I would toss that as well. So once I've done that, I am going to get my ChloroPrep, pop it, and I'm going to go in the circular motions around the insertion site. So I would do that pretty good. The key thing after cleaning, you want to let it dry. So that's imperative. That way the antimicrobial and all the stuff you cleaned it with can work and help prevent infection. So once I've done that, I am going to allow it to air dry, and if I had a bio patch, which our kit does not have one, I would place that blue side up. So I would put that on, and then I would take my Tegaderm, peel, and then I am going to place that over the central line so that we can still see the insertion site. That way we can assess for any issues. And then I'm going to peel the plastic off. Okay, and I will also date initial and put a time that I did this new dressing change on here. There's a piece of tape that was holding this up. I didn't remove it. It was already there when I started. So, and then I didn't want to cover the clamp up. So it's probably a little bit lower than it should be, but again, we're working with what we have. So after I date, time, and initial the dressing change, I'm going to remove my sterile gloves. I'm going to perform hand hygiene, and we're going to document the central line site, if there's any issues such as swelling, redness, anything like that, and the date and time of my procedure. Thank you.